So now it is my pleasure to invite Matthew Lester from the Environmental Health Directorate for the WA Department of Health. Matthew will provide an update from the Department of Health on current environmental health activities and health promotion initiatives to find, screen, treat, manage and prevent trachoma amongst the First Nations communities.
Thank you. No, that's great. Okay, thank you. Firstly, I want to acknowledge Ron Wajak Noongar Budja and pay my respects to elders past, present and emerging. And also I want to acknowledge many of the people around the tables here of Aboriginal heritage, and also the amazing other people who work diligently in this area improving health outcomes. I was a little surprised by Mitchell. He stole a couple of my slides, and then he brazenly said that Matt was going to talk about Australia's elimination of trachoma. And I thought, I don't think I should do that at an eye health conference, but we'll see how we go, because I'm going to focus on the interaction between environmental health and trachoma. Here we go. Oh no. Okay, so yeah, thanks, that's great. Okay, so the trachoma strategy follows the World Health Organization process of surgery, antibiotics, facial cleanliness and environmental improvement. SAFE. Pretty simple, easy way to do it. We know that surgery has done what it needs to do. We can always pick up people with trichiasis and offer that surgery through those normal means. The antibiotics have done most of the good work in eliminating a lot of the risk community numbers and prevalence of trachoma by mass drug administration. The net effect of that is you've got communities who are going, you know what, we're sick of taking this annual tablet. We don't want to do it anymore. We need to do something else. So when we look at it from an environmental health point of view, we turn it on its head and we call it EFAS rather than SAFE, because we need to focus on environmental improvement and facial cleanliness. They're the two biggest factors that are going to help eliminate this disease and keep it eliminated. This is the one slide where I will talk about the current rates as they're about to be reported. You're getting a sneak peek. Overall decline from 2.2% to 2% in 2023. The rates in the three areas of Australia where the jurisdictions that have trachoma is 2.5% in the Northern Territory, 0% detected in South Australia at the time of screening, and 1.8%, which is a drop in Western Australia. So that's an improvement, which is terrific. If you look at the pie chart, the yellow section, the 48, shows you of the number of communities tested. So the bracket number is 74, was that we should have got tested 74. We got to 67 communities. This is collectively across those three jurisdictions. 48 communities are free of trachoma, so that's great. That's none detected, which is terrific. The green is the 2, which means that there was trachoma detected, but it was less than 5%, which is great. So the green and the yellow are sort of the good guys, but where trachoma was detected, and it was between 5 and 20%, that was the 12 number of communities. And then, of course, you've got 5 communities there where the prevalence rate is higher than 20%. So collectively, if you add the 5 and the 12 together, that represents about a quarter of the communities tested have still got hyperendemic rates of trachoma. And that's the concern, because I can tell you now that we are on the pathway to elimination, and the dossier will be prepared and we'll be having a big party and all that sort of stuff. And yet there are going to be some particular areas where elimination continues to be a problem. And so we need to focus on other activities, different strategies. What can we do differently that will make a difference? F is facial cleanliness. That's the first picture that Mitchell stole. So, but it's from his suite of photos. So I actually stole it from them. So I had 2 photos I stole from them. Facial cleanliness is an interesting thing. So if you look at those quick stats there, the WA rate in 22 was 55%. It increased to 70%. Now this is facial cleanliness observed at the time of screening. Okay, so it's potluck, you know, and some schools, you know that the trachoma people are coming, so the kids go and wash their faces quickly before the examination. But in WA, the numbers have traditionally been quite low, but it's good to see that rise. South Australia, you can see, has raised up. You can see that the target for CDNA is 85%. And the NT, we had to swing back for the communities that were tested in the Northern Territory. There was a decrease in the facial cleanliness rate. This was a Hugh Taylor slide, and transmission is stopped by keeping every face clean. So I can't tell you enough as to how how grateful I am to Hugh for opening my eyes, forgive the pun, for how to adequately manage trachoma. So this is the longitudinal show you of the 4 health regions in Western Australia: the Goldfields, Midwest, Pilbara and Kimberley, and the rates, the rates of facial cleanliness that were observed since 2007. So you can see it's all over the place. It's a bit of potluck, but there's a no, I'm not even going to say it's getting better. I don't think it's getting worse. I think it's just all over the place. So now I'm going to talk about environmental health. So environmental health is the area of public health where we take control of these wonderful little buggers that can affect human health outcomes. So air handling is to do with Legionella, aquatic facilities, asbestos, skin penetration, all this sort of stuff. So the sort of things we've been involved in recently, we've been providing advice about the illicit gold processing that's been occurring in the backyards of bikies in Kalgoorlie, which has been producing mercury vapour and arsenic on the ground, contamination in the homes. With asbestos, we're regularly contacted by DeWer for the health impact, and I think the freeway overpass, the Stevenson overpass recently identified, they went to dig up an old tip site to extend the roadworks, and they found a dumping ground of asbestos. So all work there is stopped until it gets remediated. We do odd things like massed events. So we actually have people who attend every concert, the poor buggers, to make sure that it's safe. But it's more about the ingress and egress, so the emergency exit. So suddenly in case there was crush injuries, in the event that people need to get out of a massed area with large number of people, footy match, suddenly needed to evacuate quickly. So assessing that they've got the right safety features there. Anyhow, this is all backed up by the Public Health Act and the Health Miscellaneous Provisions Act and the 37 regulations that sit under there and that are enforced by the Health Department and also local government health inspectors. Aboriginal Environmental Health Program is something a little bit different. It's non-regulatory, and I think that's the important thing. We are not in community to apply penalties to people. We're in community to try and improve living conditions. That is its sole purpose. The way we do that is we know that we are not the experts in community work, so we engage external service providers. We've got around about 18 service providers, 15 of them are Aboriginal community-controlled organisations. All of them are welcoming community, all of them have established safe practices in working with community. Traditionally, our programs looked at the community-wide sort of application. So you see it's just rubbish control, putting there, that's a nice big septic tank that's spilt, and the black water has basically come out into the common area of the community, that big puddle of black water. You know, if you've been to a lot of remote communities, that bare feet are quite common. Burning off of tips is illegal according to her, but it's the best way of managing the volume of waste and also rodents and animals that scavenge there. So, it's a practical way of actually doing these sort of things. But I want to talk about the home environment because that is the single most important environment that actually has the ability to change people's health outcomes. And I want to acknowledge Deb from Graham's here particularly. I've said it to her once before, but I'll say it again. It's from a conversation I had with her many, many years ago, and she was saying, it's killing me. My people are coming back from hospital after receiving treatment, and they're going back to homes that we know are going to make them sick. How can we change that? How can we improve that? How can we work with people to understand that difference? And I guess that's where we've tried to insert that type of learning and knowledge. So it's an empowerment process, but it is about the house as the single most important environment for people's health. It's where you spend most of your time. It's where you eat your food. It's where you sleep. It's where you share. It's where you share bathrooms, you share bedding, you share all of this sort of stuff. Housing for Health, you would have heard, is a health habitat model. They talk about the 9 healthy living practices. I just chucked it up there just as a reference point. I'm sure you've heard of it before, but they've taken this demonstration model to many remote communities, and they've also applied it overseas in places like Nepal and even the slums of New York. And it shows a difference that if you send trades out and maintain the health hardware in the home, that people's health improves. These are the healthy living practices which were essentially devised by a doctor, an architect, and an Aboriginal elder by the name of Yami Lester. So these are the most important things that need to be done in a home so that people's health is protected. And the first 2 are probably the single most important bit, that is the ability for people to wash themselves and wash their clothes and bedding. All right, they're pretty logical. They're nothing, it's not rocket science, but you know, once you get down to controlling temperature and reducing trauma hazards, they're sort of on the luxury list at the moment, because when we go into many, many of these homes, the conditions of the homes are really, really challenging. What's really interesting is that the conditions of the homes are not the fault of the people living there. They're the fault of the organisation that fails to provide routine maintenance in housing. This is just some of the snapshots that we've seen in houses. So the top right is a toilet which some bright architect decided to put drop toilets in Aboriginal homes in a community, despite the fact if there were non-Aboriginal people living there who had plumbing, because they can't live with these sort of things. So these were designed for a house with a normal occupation of 2 adults, 2 children. Guess what? There's more than 16 people per house at any one point in time. That drop toilet there was chock-a-block right to the rim. I've got 5 minutes, I'm going. Okay. But they're the sort of things that you can come across, and you can do something about that. The fork in the RCD there was a classic where a lady who just said, yeah, the power kept shorting out. So it was the only thing that stopped the power shorting out. And she said, but when I use the sink, I've just got to be a bit careful because the tap can electrocute me a bit, you know. So, and the same as the booster there with the knife in it stuck into the switch to keep it on, because, yeah, I want hot water. I don't want to wait for it. I want it on all the time, you know. So, no, it's not working. Anyhow, so going back to the house, one of the things we started with Hugh and the Indigenous Eye Health Mob was to do a safe bathroom check. We thought, okay, if there was one room in the house that really would make a difference to people's health, what would it be? And it was the bathroom. It was pretty simple. Go in the bathroom, check the taps work, check the drain works, check they've got soap, checks they've got a mirror, check they've got a mirror at the height of a kid so the kid can see if their face is dirty, instead of the mirror that's above a counter where no child until they're about 9 or 10 can actually see themselves. When we did the Safe Bathrooms program, we did it a long time ago, most of the things we found that most of the maintenance will work. Yeah, there was hot water, there was everything was basically functional. But what was missing was what was in red. So there was no soap. There was no soap in the shower, there was no soap in the basin. There were very few towels. There was usually only one towel, and people were sharing towels. So of the things we know about trachoma is the ability to wash your face regularly, routinely, use soap preferably, and don't share towels. They're the sort of like key messages, all of which couldn't be demonstrated. When we've looked at environmental health, in WA we've had a little bit of an ability to play a bit more, and we've done some housing blitzes. So we've managed to actually combine with the Department of Housing, or Department of Communities who run the housing program, and actually go and visit communities. So communities invite this process. It is done with local services at invitation, all right? And then you go basically, and the blitz is only because you go through every house in community. Every house gets a visit, and they're offered a home health hardware check. So someone will actually go and check everything that needs to be fixed. And trades are with you to fix it there and then. And when you move on to the houses and leave the community, the trades will stay there until everything is fixed. And so housing go, this is great. We don't have to keep paying a transport of a worker for a particular job. They've got a single job item and they go, oh no, I'm here to fix that tap. I can't look at that because my job is actually just this. But I'll be back next week when you raise that. So the transport from people to go from base to remote locations is outrageous. I just wanted to just chuck some numbers out there, but you can see what sort of things can get done. I think here the soap bars were donated by Soap Aid, who remill soap from hotels in the eastern states, remill them into bars. So they are shipped across. We've distributed something like 150,000 bars around Western Australia, and these are only offered. These are never enforced, okay? But when we do a service in a community, we know that there's no survey without fix. You don't go and assess a home without providing something in return. So we will change light bulbs, something as simple as that, and we're now up to about 6 to 8 light bulbs per house, because in community, they're about $12 to $18 for a single light bulb, because they're special low energy ones. Shower heads, we get them replaced, we get them supplied by Watercorp. We'll replace the shower head. Everyone knows hard water clogs up the shower heads, the shower head dribbles, people rip it off or whatever, so just replace the shower head. It's a simple fix. I think when we've gone through and had a look at these houses, this is stats for the last year, that's all, just stats for the last year. But houses with evidence of pests show that we need to do more in that place. There's a lack of washing machines, and they see there the issues that affect the ability to wash. 515 identified, 213 fixed on the spot, and 402 referred to those trades that followed through afterwards. So they're the numbers of bars. I'm running out of time, and I'll stop this one, but just to show you that we've distributed a lot of bars. Actually, the biggest problem we had with the bars was the bloody freight from Perth to get them to where they needed to go. So they were delivered to Perth. It was all free, and then suddenly had to pay for the freight, you know, and soap's not light. And I'll leave you with this one. Anyone who's got a clinical sort of model and anyone who's involved with Aqua will be aware of this type of approach. This is the way of the future. This is where environmental health will work with primary care. And it needs to be done with an ACHO or an Aqua member here. This has to be done this way so that you've got cultural safety and confidentiality. But basically, a person presenting in a clinic with a diagnosed preventable illness, regardless, and Trachoma fits that, bang on, related to poor living conditions, is offered a home visit by a team of Aboriginal environmental health practitioners who will assess their health hardware, report the damages or fix, they'll fix it at free of charge, and work out whether is it where you live or how you live. Do we need to actually understand? So we need health literacy and health awareness of the disease linkage and the home condition. So how do you do it then? So that, I think, is probably our next biggest burden, is trying to work out how you bring people on that journey. But it's not a single visit. It's not a single encounter. And it's certainly not a clinician in a clinic saying, you've got this and you need to do this, because they're in shock when they've often been told they've got a medical condition. And they walk away going, I'm not sure, the world's just come crashing down. So this is an opportunity of one of what we were talking about before and what's been raised in previous ones, holistic wraparound services that actually support people through a journey rather than judge them. And this is what I think needs to be focused on in post-elimination. These referrals have got to be key. The clinicians have got to know that they're there, and they've also got to know that they will be responded to and that something will happen. I think we need to look at health status as a priority for housing repairs, and I'm speaking with the Department of Housing with that in mind, so we can bump up health status to get a priority repair. The first 1,000 or 2,000 days, I'm not sure what the current model is now, are the most important that set the tone of disease prevention for the rest of your life. So let's get that right. Why aren't newborn bubs and mums and bubs being offered a home assessment, repairs, get it clean, get it ready before they go home? I think that's a really important one. I'll leave it at that. Thank you.